Hello, good day, sir.
So I am. Oh, okay, doctor, can you hear me?
Loud and clear, sir.
Very good. So let's take another disease that is also common in our environment here in Nigeria. It's a transportation sickness, like induced disease, and that is pasteurellosis.
Okay.
Pasteurellosis, yes. Is the causative agent is Pastorella multiseda, the one that affects ruminants, cattle to be specific, Pastorella multiseda and Pastorella hemolytica. So, and the name of the disease, if as you might have studied during undergraduate, we have Pasteurellosis bovis, shipping fever, hemorrhagic septicemia, stockyard disease, exotic pneumonia of calves, swine plague, and so on. So, like I said, there are two different forms of the disease, the septicemic form and the pneumonic form. And there are two different organisms that causes such, multiseda and hemolytica or hemolyticum, depending on the literature you're using. So, and the characteristic of the organism, if you recall your microbiology, they said it's a bipolar gram-negative coccoid bacterium. So, but when an animal is being infected with Pastorella, there are incriminating other bacteria, especially Corynebacterium pyogenes. It's a secondary embedder in Pasteurellosis, especially in bovine and ovine species. Uh, of course, the distribution is a worldwide distribution. The pneumonic form is the commonest form in temperate areas, like in Europe and America, while the septicemic form mostly common in Asia and Africa. But the two forms of the disease, as we reported in Nigeria, the hemorrhagic septicemia being the most serious one. Outbreaks occur especially during rainy season because, like I earlier said, it's a transport-induced disease. Uh, these marketers or livestock marketers, sometimes when they pack animals from the northern part of this country down south, most of the time they lose some of the animals as they on transit. and they will throw it, or they will, if they are lucky to slaughter it, then it will be sold. But otherwise, this is one of the diseases that normally make them to lose a certain substantial amount of money while on transit. Because you can imagine during rainy season, the weather become harsh, very cold, and see stress being induced by the free radicals. And so transmission is mainly by contact and by consumption of contaminated food and water. In some cases, droplet infection is significant. Calves may become infected from mammary gland of the dam. Ticks and biting insects have been suspected, but they are not really been established. Susceptible host, most of the time are ruminants, cattle, camel, sheep, including swine, including rabbits. But my concern, or our concern, is cattle and small ruminants, which is larger animals. The clinical signs or some of the predisposing factors, apart from stress of transportation or sudden change in weather, introduction of a carrier animals is also a predisposing factor. Poor housing condition and anything that will lower the immune resistance of the animal can also predispose to it, including stress due to exertion from trekking from one part of the country to another, or from one locality to another, especially when there is feed scarcity. So the clinical signs are divided into two. The septicemic form, like I told you, mostly Pasteurella multicida is being incriminated. They call it type 1 or B. Occurs in outbreak during environmental stress. Incubation period is 3 to 5 days. And you will see some nasal discharges, salivation, dyspnea, a rapid pulse rate. Sudden onset of fever ranging from 41 to 42 degrees Celsius. The animal goes fit. You recall that most of the time, if you see the temperature going up, meaning fever or pyrexia, the animal will not eat. So you have complete anorexia. And of course, to certain levels, sometimes you have ruminal stasis. Because if the animal is not eating, most of the time we may have ruminal stasis. And if care is not taken, we end up having bloat. So as a result of this, the animal, those that are producing milk, will be reduced or completely ceased, severe depression. And if there is no intervention, the animal may die within 12 to 24 hours when there is no intervention. So, and this is the septicemic form of it. And the pneumonic form of the pasteurellosis mostly is a combination of the multicida and hemolyticum. There is always a pulmonary involvement in this combination. And transmission, like I said, is by inhalation, and most common among young animals in the feedlots. Dyspnea, pleuritis, friction may be audible. High temperature in this form, just like in the septicemic form. The animal also goes off it. Mucopurulent nasal discharge, crusty nose, and ocular discharges. Milky diarrhea may be present. This is toxemia or bronchopneumonia of a sudden onset. So the hemolytic form also cause the lysing of blood, where we could have pale mucous membrane, but the lysing of blood is not to a level that we can have icterus or hemoglobinuria. It's not a picture here, but an hemolytic Pasteurella will result into pale mucous membrane. And that is why sometimes in the field, you have a problem of differentiating whether what you are dealing with when there is respiratory involvement alongside pale mucous membrane. Then you begin to wonder whether you are dealing with a respiratory disease and alongside helminthosis, whether due to any of the classes of helminthosis, helminths, either trematode, nematode, or cestode. So in the field, sometimes one will be tempted to take to deworming and administration of antibiotic blindly. So, but here I'm drawing our attention to the fact that you may have concurrent, the two forms of pasteurellosis occurring concurrently in the same heart, meaning you could have the pneumonic form, and at the same time, you could have also the septicemic form, meaning you could have Pasteurella multicida and Pasteurella hemolyticum. So very deceptive, who can deceive. So in this manner, most of the time, when you administer antibiotic, you may likely see the resolving of the mucous membrane. Instead of becoming pale, it becomes begin to turn into normal, unless if there are other blood-sucking endo or hemoparasite alongside the pneumonic form that is exhibited, manifesting in respiratory signs that we have enumerated earlier on. So, differential diagnosis for the septicemic pasteurellosis. Anthrax sometimes may be incriminated because in the septicemic form, there is always this level of hyperemia or hemorrhagic mucosa at the muzzle, or some visible mucous membrane will be hemorrhagic. So, but the difference between this sign in the septicemic form and anthrax is that, anthrax, the blood will not clot. And there's more of hemorrhage in anthrax compared to the septicemic form of pasteurellosis. And then in anthrax, of course, you know that there's marked enlargement of the spleen in anthrax, although postmortem inspection or examination is not recommended in anthrax, because you may be exposing yourself and also contaminating the environment. So, and there's marked cyanosis in anthrax compared to pasteurellosis. The other differential diagnosis that may be confused with the pneumonic form of pasteurellosis is our friend contagious bovine pleuropneumonia. The postmortem lesions in pasteurellosis and CVP are similar, especially when it comes to accumulation of fluid in the thoracic cavity, dyspnea, salivation, and rapid pulse rate and all that. They seem to share a common sign that may be confused with. So diagnosis. Sometimes when you collect sample and you want to isolate the causative agent, alongside you will have this Corynebacterium pyogenes that causes abscesses it is all most of the time being isolated alongside. So treatment, being a bacteria that is gram negative, it responds to tetracycline treatment at 10 milligram per kg body weight. Sometimes one can also give intravenously, not the long-acting, the short-acting oxytetracycline at the dose of 10 milligram per kg body weight intravenously daily for up to 3 days, and can also be given subcutaneous or IM. So, but most of the time we go for IM because hardly will you see oxytetracycline that the manufacturer will recommend administration IV. But in the field, sometimes we go slow IV, and you record appreciable result because plasma concentration of the drug will be reached within the shortest time period. There are other antimicrobial agents like chloramphenicol, sulfamethazine can also be effective. Control. There is a vaccine called hemorrhagic vaccine. MBRI worm, they produce such kind of a vaccine. Pasteurella hemorrhagic, I've forgotten the name of the vaccine, but they have a vaccine for pasteurellosis in cattle. Pasteurella hemorrhagic vaccine, I think something like that. I will check later and maybe tell you. But there is vaccine being produced by MVRI against this.
Is the vaccine also used in
then what?
Is the vaccine also used in goat and sheep?
Hello? Whether the vaccine is what?
Used in goats and sheep.
Hello? Gold and field.
No, I'm asking, is the vaccine also used in goats and sheep?
Oh, no, throughout my field experience, we've never used it in, I don't think it's recommended in other animals aside the cattle, unless if they are modified of recent. Most of the time, it affects cattle and is being administered to cattle.
Okay, sir.
All
and
right.
also the
So,
differential
any question
diagnosis, CBPP.
Yes.
Yes, on CBPP, the differential
what?
diagnosis, what is the distinguishing
Yes.
stand that separates Pasteurella and CBPP?
I'm not getting it. Can you repeat yourself?
Okay, I said in the differential diagnosis which CBPP appeared, what
Yes.
is the clinical sign that
Yes.
differentiates the two diseases?
Okay, between CVP and pasteurellosis.
Yes, sir.
Hello. Okay. If you check, go over the clinical sign carefully, you realize that in CVP, there is no pale mucous membrane because there is no involvement of the blood compared to pasteurellosis, where you have hemorrhages at the muzzle or level of hyperemia at the muzzle or mucous membrane. In CBP, we don't have such. You hardly see such kind of a sign. So that alone is a pointer. And then in CBP, most of the time is they may not be history of traveling from or transportation from one point to another that may induce the disease. But in most cases of pasteurellosis, history will have it that they might have passed through a certain form of stress that may include transportation or poor housing. It has to do with weather largely compared to CVP. Do you get it?
Got it, sir.
Hello? All right.
Sorry, you
So
had me. I
any
got it.
question or what?
I got
Hello?
it loud and clear. Thank you very much, sir.
Okay. All right. I'd wanted to also talk about nocardiosis that is also related to or similar to tuberculosis. And
Okay.
nocardiosis, yes, because is one
But
of the is is one of the incriminating differentials when you are testing for tuberculosis.
okay, sir. I actually wanted to on this pasteurellosis. I wanted
Yes,
to talk more about the Mutocida strain. I heard of more of the hemolytic, but I didn't hear much on the Mutocida.
I didn't get it.
I said on the what do you call it? On the pasteurellosis.
Yes.
Yeah, I want you to actually talk more on this the septicemic form, the pneumonic form. Is it linked with the different strains like the Mutocida and the hemolytica? Or is it that the Mutocida can cause both? I want to get that very clear.
Aha. Yes. Multicida can cause both. But when you now have the hemolytica hemolyticum will not cause or may not cause the septicemic form. But Pastorella multicida can cause both the forms of the disease. And you know the hemorrhagic that is where the name is also derived, hemorrhagica, Pastorella hemorrhagica. I think that's the name of the vaccine, if I'm not forgotten. So what I am saying is that if you check the clinical sign of the septicemic form and the pneumonic sign of it, both in the two forms, the Pastorella multicida is involved. In the septicemic form, it is multicida type 1 or type B, while in the pneumonic form is multicida type 2 or type A. You get it?
Yes, sir.
Yes. But I am saying, in addition to the pneumonic form of it, hemolyticum is also involved. And then there is also an invader, Corynebacterium pyogenes, which most of the time results into abscessation in the lungs. And you know, if you do PM, if you see abscess in the case of a cow that die of pasteurellosis, you will see sometimes you see this abscessation, telling you or indicative that Corynebacterium pyogenes is involved. While in CVP, you may not have these abscesses. or abscessation. What you have is the fibrin deposit. The lungs, the lung tissue become like a liver, but hardened, fibrotic. They call it hepatization of the lungs. So the two can be differentiated even based on that.
Okay, sir.
All right.
But sir, please, the septicemic form.
Yes.
I, I didn't get much on what you said there, sir.
Okay. The septicemic form of the Pastorella, I said mostly you realize that it involves hyperemia or hemorrhagic mucosa. That is the septicemic form of it. While in the pneumonic form is mostly respiratory signs.
Okay. Okay, sir.
Then as the disease advances in the septicemic form, you will see swelling along the head, neck, throat, vulva, anal areas, and which is hot and painful. But in the mucosa of those organs I mentioned, one of the striking things that you may likely see is this level of hyperemia or even hemorrhagic mucosa. Then this high fever, rapid pulse rate, salivation, and of course, there's some level of upper respiratory involvement, but in this case, it's nasal discharge. While in the pneumonic form, the lungs are involved, bronchopneumonia largely is involved. In addition to the discharges, mycopurulent discharges, mostly, like I told you, the corynebacterium is involved, causing this abscessation in the lungs. I don't know. Am I confusing you? Is it making sense?
I just want to know, how can one understand a case of bronchopneumonia in the observation when you know that there can be mucopurulent discharges in the septicemic form?
When you to differentiate between the septicemic and the pneumonic form, when you know the multicida will cause both, depending on the type of the multicida, whether type 1 or type 2. So, but whether this one you are dealing with hemorrhagic form, or I mean the septicemic form, or you are dealing with the pneumonic form. The septicemic form, I told you, one of the key things that you can easily see as a clinical sign, it is this hyperemia. It is this hemorrhagic mucosa. So it's a pointer in addition to high temperature, anorexia, and the rest, which are general clinical signs. While in the pneumonic form, that one is obvious. Even sometimes when you do PM, or if you are talking of clinical sign, you will see all these sign that is that is attributed to the respiratory system that has to do with the lungs, particularly because being pneumonia, if you auscultate, you are likely to hear this crackling sound because of the level of the pneumonia that is involved, and sometimes even abscessation.
Okay, sir.
Maybe you need to to read more if it is confusing, but
Okay,
I
sir.
don't see much confusion there. Maybe when you read and you are still having issues, you can call me. I can still explain.
No problem, sir.
All right. Um, let me also talk about. Sorry, you might have been hearing some sound. I am also with some students in the office, but they are doing other things. I one of the incriminating bacterium that normally gives. Hello, Dr. Pilas, are you there?
Yes, I'm here.
Okay. So one of the incriminating bacterium or bacteria plural that is being incriminated in when you are testing for tuberculosis using tuberculin test is this nocardiosis. And even when you want to do postmortem meat inspection, nocardia can also mimic some of the postmortem lesions that you may want to see in tuberculosis. So, and then morphologically on the plate, when you now culture Mycobacterium bovis and then also nocardiosis or nocardia astroides, when they are together on the same plates, the tuberculosis, whether M. bovis or whatever species, most of the time, especially M. bovis, the edges are round and mucoid, while for nocardia, it is rough and sometimes elongated,
Sorry,
like
edges around what, sir?
like thread. Are rough. It has rough edges.
Edges of what, sir?
The colonies on the plates, colonies.
Okay.
Yes. If you pick a colony, let's say you have cultured them on a plate. Anyway, let me not go into microbiology. The point I am making is that the tuberculin test that okay, let me start from the PM lesions. When you see abscesses, most of the time at the head, the submandibular lymph nodes, there are abscesses in those lymph nodes, including the pharyngeal lymph node, mediastinal lymph node. If there are abscesses, most of the time it may turn out to be nocardiosis. Most of the time. So if you're doing tuberculin test, one of the things that will give you a false negative or a false positive is nocardiosis, because in nocardiosis the tuberculin will test positive instead of being negative. So you may think that you're dealing with Mycobacterium bovis, whereas it is nocardiosis. But the mechanism behind it, why it is giving a false positive instead of being negative, I think it has to do with maybe the common protein that they have with Mycobacterium bovis. I'm not looking at it critically, but most of the time, when you have nocardiosis, it will give you tuberculin positive. So it's one of the disadvantages of using tuberculin as a way of screening the heart. And like I also pointed out, one of the things that will also give you a false negative is also advanced pregnancy. When the animal is infected with bovine Mycobacterium bovis. So this is one of the few things that I wanted you to know pertaining nocardiosis. I think I may want to stop here. I am getting exhausted. Unless if you have any other thing you want me to elaborate.
No.
Hello?
Not too much, sir. Can you hear me, sir?
Can you hear me, sir?
Yes, I'm hearing you.
Okay,
Yes.
okay. So on this
Mm.
nocardiosis, does it have any
Yes.
pathognomonic sign?
In the field, I've not come across nocardia or nocardiosis, but during post-mortem meat inspection, I've come across it, and we have also, I don't want to say isolated, we have also seen the colonies of it when we were culturing mycobacterium. So one of the things that we saw on the head of that cattle that we suspected to be having tuberculosis uh, is abscessation in those lymph nodes. And after culture, it turned out to be nocardia. So, but in the field where you are expected to see the clinical sign and say you are dealing with nocardia or nocardiosis, I have not come across that throughout the period I have been in the field. So in that situation, we can only rely on the clinical sign that is in the literature.
Okay, sir. Thank you, sir.
Hello? All right. Hmm. So I think we can call it a day, or let's see if there is a pressing disease that you want me to discuss with you.
Mm, Kai, there is
Or
this.
maybe later. Uh-huh.
Yeah, what I'm
Okay.
saying is, since it's not really um related and it's not this, I don't know if I can let you rest. Maybe I can forward the pictures to your WhatsApp, and then you look at it for me and tell me what I could be dealing with.
Okay. All right. So you can forward it. That case of beeswax stink,
Yes.
the bee stink. You said there was improvement after we have discussed. I don't. What is the situation of the animal now?
Right now it is eating. After this lecture, I'll be
Okay.
going over to go and check on the animal because I've not been there today. So it's eating
Okay.
from the report and it's actually responding. The swelling
Okay.
on the face has reduced. The only place that the edema is still
Okay.
persistent is in the ears.
In the ears,
Yes, sir.
the edema is persisting in the pinna, the ears.
Yes.
Okay. So, did you check whether there's hematoma?
I've not checked, sir.
Because if it is a hematoma, you may have to drain it.
Okay.
So when you get there, you check.
That means I have to open up to see if there is blood.
You can use you can
Mm,
use a 18 gauge needle to aspirate and maybe create a slit that it can drain.
okay.
Yes.
I'll do that, sir.
All right. So it seems as if you are the only candidate that have been receiving the lecture.
It seems, sir.
So and I don't have the list of I don't have the list of the students, or maybe I will have to check with the coordinator. Maybe other students, they may be reading it because we have different categories of students.
Yes, sir.
Some are master students, some are PhD holders. We may even have professors that are also that have been enrolled as students also, and that is their own field too. So some may not really look at the lecture as being necessary. I don't know, but attendance is good. They could have even logged on so that they can share their experiences with fellow students, including some of us that are research persons. Nobody has monopoly of knowledge. That's why we share ideas, especially at this level of postgraduate studies. What you have been seeing in your own area in the field, and what we have been also seeing here. When we now put our heads together, we arrive at something, cross-fertilization of ideas. But by and large, it's interesting. So thank you, and have a nice evening.
Oh, thank you, sir. God bless you, sir.
All right, bye-bye.